Welcome to another question and answer session. This is the physiology portion. Which of the following statement relating to the Gardner variant of familial adenomatous polyposis coli is false? So this is important question which is false regarding the Gardner syndrome. Gardner syndrome is a special variant of the FAP, which is the familial adenomatous polyposis coli, and it is the mainly presentation is the colonic polyp. So colonic polyp with extra colonic manifestation is important extracolonic or definitive extracolonic manifestation is known as the Gardner syndrome, and we have to find out which is the false regarding the Gardner syndrome. First of all, it is autosomal dominant condition. Patient may have a retroperitoneal desmoid tumor. The vast majority of the polyp are benign, and thus risk of the colorectal cancer is small. Patient are increased risk of thyroid cancer. It is characterized by mutation of the APC gene. So we have to find out which is not true or which is false regarding the Gardner syndrome. So first of all, this is a picture. This picture shown the epidermoid cyst. Here we can see the different part of the body, the epidermoid cyst. Actually, this case was dealt by us in our department. And here we can see the epidermoid cyst. It is the cutaneous manifestation of the Gardner syndrome. The Gardner syndrome also present different type of other clinical features, such as the different type of the osteomas. It also supernumerary teeth. That means the more than 32 teeth. Also there may be development of the desmoid tumor, and also there is the thyroid cancer. So there are different type of the pathology is present with this syndrome. So Gardner syndrome, what is the Gardner syndrome? Here we can see the Gardner syndrome. It is the autosomal dominant, and it is a family of the familial colorectal polyposis coli or FAP. So FAP, which is one of the familial cancer of the colon, and this variety Gardner syndrome present, and the multiple colonic polyp also present here. The multiple colonic polyp, but not more than 100. Extracolonic disease such as the skull osteoma. This is very important. The extracolonic manifestation, they are the skull osteoma, thyroid cancer, epidermoid cyst. There also may be the other options, and this other option like the fibromas and thyroid cancer. Also the fibroma may be present here, so this is also important, the fibromas. So the most important, the skull osteoma, thyroid cancer, and epidermoid cyst. Though the Gardner syndrome is rare, but it may be present sometimes. And the desmoid tumor, it gets in up to 15% of the case. And the mutation of the APC gene located in the chromosome number 5, which is the short term of chromosome number 5 in 22 location. Due to colonic polyp, most patient will undergo colectomy due to reduce of the colorectal cancer. That means when there is more polyp, so there is a chance of the colonic malignancy from the colonic polyp. So in this condition, prophylactic colectomy, prophylactic right hemicolectomy or left hemicolectomy or pan-proctocolectomy, that may involve in surgical treatment. Now consider a variant of the familial adenomatous polyposis coli. So Gardner syndrome, it is the familial adenomatous polyposis coli variant. So here we can see this patient, this is the cutaneous manifestation, this is the cutaneous manifestation, which is most of them are epidermoid cyst. So epidermoid cyst, it is one of the clinical feature of the Gardner syndrome. Also there may be development of the lipoma. Also there may be osteoma of the skull, osteoma of the jaw. Also there also may be supernumerary teeth. That means there is more than 32 teeth. That means other teeth present in the floor of the mouth. Also there may be development of the thyroid cancer. So the group of disease present in case of the Gardner syndrome. So the multiple polyp increase the risk of malignancy, and most patients undergo colectomy. That means the treatment is the colectomy. And here also we can see the cutaneous manifestation of this patient. So, which of the following statement leading to Gardner's variant of the familial adenomatous polyposis is false? First of all, it is the autosomal dominant. We know it is true because the familial adenomatous polyposis coli, most of them are the autosomal dominant. Patient may develop retroperitoneal desmoid tumor. It is also true. The desmoid tumor usually develop after a surgical procedure. So, in the Gardner syndrome, it may be developed. Vast majority of the polyps are benign and the risk of colorectal cancer is small. It is false option because we know the risk of colorectal cancer is high in case of the APC, that APC mutation and familial adenomatous polyposis coli, and there is 100% risk of development of the cancer. This is the 100% risk of development of the colorectal cancer in case of the familial adenomatous polyposis coli, and the Gardner syndrome, it is a part of the familial adenomatous polyposis coli. So when there is the polyp present in the intestine, we should go for the surgical removal of the colon. Patient are increased risk of the thyroid cancer. It is also true. It is characterized by mutation of the APC gene. It is also true, which is the APC gene located chromosome number 5, short arm, that means Q, and 22 location. So it is short about the Gardner syndrome. Thank you.